A prolonged health assessment is a medical review of everything about you and your health, physical, psychological, social, and it allows us to look at what are your risk factors at the moment and where are you headed with those risk factors. Are you on a path that is going to see you sail through without developing diabetes or high blood pressure, or are your current lifestyle choices putting you at risk of those conditions? Anybody who's got a risk factor for any chronic disease qualifies for a prolonged health assessment. So it could be a family history of someone in the family having diabetes or heart disease. It could be yourself already having high blood pressure. It could be having high cholesterol. If you've already had a cardiac event or some other sort of vascular problem, then that would qualify you as well. If you can pick up an unfavourable trend in your late 40s, then you can make changes that will prevent you developing those diseases later in life. And certainly, if you don't have a heart attack in your 50s and 60s, then there's no reason why you can't live a very productive and healthy and enjoyable life right up into your 80s and beyond. The government's currently providing support for these medicals, so we don't charge for doing that base assessment. We usually provide 2 hours of your time. Initially, the nurse will do an assessment of some of your basic calculations, and then you'll spend an hour with the doctor, followed by an exercise stress test. Everybody hears the story of the guy who dies on the treadmill who's super fit. So fitness is one of your risk factors, and it's great to have that under control, but it doesn't account for the other 3 or 4 risk factors for heart disease. And if you've got a predisposition, despite being fit, you can be at serious risk. So it is important, and it's good that you're keeping fit, but it doesn't protect you completely from significant vascular disease. No, there may be a reason why you shouldn't do some parts of it, and we wouldn't do those parts of it if they're contraindicated. If you had a sore hip, we would not put you on the treadmill, as an example. It really depends on the result. If the result's excellent, then you probably don't need to have anything done for 5 years. If the result's concerning, then you need to address those risk factors and then have that process monitored until they're normalised. And then once they're normalised, you'd have a review program that'd be based on how well you can get your risk factors under control. Usually your own GP. But if your own GP doesn't have the resources to do it, anybody with the facilities can provide the report, and then you can decide who's going to follow up those identified issues.